Hi everyone, my name is Dr. Michael Wald, the Blood Detective. I am a doctor of chiropractic. I am board certified in nutrition. I'm a dietitian and sports nutritionist. I am a life coach. I even provide acupuncture for my clients, and I have a medical diploma, but not a license to practice medicine. Today's topic is blood thinners, medications versus nutritional supplements. And the reason I decided to do this talk was because over the last 33 years or so of my career in holistic health, I've had many clients who have been recommended various blood thinning medications by their physicians, and they simply did not want to take them. They felt they had too many side effects and risks, so they come to someone like me for alternatives. So I'm going to be speaking about some of the potential alternatives for blood coagulation, but I want to make sure that you understand that this information is for your education. It is not meant as a substitute for sound medical or health advice, and specifically in the area of anticoagulation or thinning of the blood, you don't want to mess around with this. If you've been recommended medication to thin your blood for various medical reasons, you should do it. If you decide not to take the prevailing medication prescribed to you, then you seriously want to look in some natural ways, assuming, of course, that you really do need to produce some effective blood thinning given your health problems. So also this topic came up because there is a Lancet article that was reported on a medication called clopidogrel, and clopidogrel is a generic blood thinner, and basically the Lancet, a major medical journal, found that clopidogrel, a widely available blood thinner, was more effective than aspirin in reducing the risk of major cardiovascular events, including heart attacks and strokes, in people with coronary artery disease. Clopidogrel users had a 14% lower risk compared to those on aspirin, with no increase in bleeding risk. Well, some studies do say that there's some increased bleeding risk with clopidogrel, but it is nothing near aspirin. So although aspirin may reduce the risk of thrombotic clots, or those caused by a clot, a thrombus, it also increases the risk of hemorrhagic strokes. So I never was a fan of aspirin. Now, having said that, this particular study in the Lancet pulled data from 29,000 patients across 7 clinical trials over a period of about 5.5 years. So that is a really good that is a good study. And because clopidogrel is both affordable and widely available, the study suggested that this will probably be the preferred option of anticoagulants for most people worldwide. We shall see. And because that is a big statement, people needed to know about anticoagulation regarding nutritional options. Now, I also want to say that if you are on a medically prescribed anticoagulant, I don't care what it is, you should not be taking natural forms of anticoagulants unless you are under the very intense auspices of a trained holistic practitioner in this area. So clopidogrel's effectiveness can vary also from person to person, depending on whether or not they have genetic penetrance or genetic enzyme activity that is involved in activation of this drug. So depending on the I would say the workings of a particular enzyme system known as CYP2C19. One person may have this enzyme working well, another person may have the enzyme not working so well. They will have a difference in terms of how well they respond to clopidogrel's anticoagulant effects. So even though we know that variations in this enzyme activity directly affect clopidogrel's effectiveness, you would think that physicians are routinely measuring for this enzyme, but they're not. So you need to ask for it, because if the enzyme is not up to snuff, if it's not working as well, this may not be, the clopidogrel may not be the best choice for you. So as my chart here says, people with reduced function, either intermediate or poor metabolizers, that's all based on the activity of the enzyme. There's a significant portion of people in the population which will not benefit from this medication. So you don't want to be one of those that needs anticoagulation, you're prescribed a clopidogrel, and you don't get the effects, and that can put you at extreme health risk. So I wanted to review this quick chart with you that basically reviews a couple of natural anticoagulants and then also clopidogrel against aspirin, and then there's warfarin, also known as Coumadin. And if you look at the all the way to the left, it'll show the agents. So it'll say omega-3 fatty acids, and under that's garlic, ginkgo, aspirin, clopidogrel, and warfarin. Then the mechanism of action, how they work in the body, what they're usually given for in terms of health issues with the patient, their diagnoses, what the bleeding risk might be, other risks of taking these different nutrients and also medications, and if there's monitoring involved or not. So for example, omega-3 fatty acids reduce platelet stickiness. That's a very important aspect of anticoagulation. And omega-3s decrease the activity of something called TXA2, which is a coagulation pathway. And it's good for heart health and triglycerides, as it says here in the primary use. Bleeding risk is very mild. You'd have to really overdose someone with a lot of, in the 7, 8 to 10, 12 gram range to have any bleeding risk. And then other risks or issues that might show up with omega-3 fats would be a GI upset, a gastrointestinal upset, and then oxidation if the oil's rancid or bad, so don't consume bad oil. And there's no monitoring from a coagulation perspective according to medicine. But omega-3s you can use peripheral blood smear to manage and watch for the platelets to become from sticky to not sticky. So there is actually some monitoring, technically speaking. With garlic, its active ingredient allicin helps reduce platelet aggregation. It's good for cardiovascular disease, blood pressure problems, cholesterol. There's some mild bleeding risk with the garlic. And I'll just show, if you look at ginkgo, the next one, there's also mild bleeding risk of both the ginkgo, the garlic, and the omega-3s. But when it comes to aspirin and the clopidogrel and the warfarin, you've got moderate risks for aspirin, moderate to high risk for clopidogrel, and the warfarin is also high risk. So the medications are much, much trickier, and they do come with a high risk of bleeding issues and also inflammation and ulcerations in the intestinal tract when it comes to aspirin. And you'll see under the other risk factors that, GI upset is about what you experience with the natural things. And for aspirin, there's Reye's syndrome in kids or kidney issues with people taking aspirin chronically. And with the clopidogrel, there is the risk of a person having a problem with the enzyme system that deals with this medication, known as CYP2C19, and there's also gastrointestinal bleeding issues. And with warfarin, there are many food-drug interactions. For example, doctors tend to say if you're taking warfarin, then you should stop eating your vitamin K containing foods. Now, after decades of that advice, we know that's wrong. If you're eating vitamin K foods, you simply don't add any in addition to that, but you don't eliminate that from your diet if you begin or when you begin warfarin. And then warfarin, just to jump to that, it requires testing every 10 days or so of INR, the International Normalization Rate. And then people who take that drug, in my opinion, they need to get, it's a tiny little lab measure of INR where a person can measure their INR levels at home, because half the time, some studies have estimated that people who are on warfarin are not getting the anticoagulation they want. And if you wait much longer than that and you finally go to the doctor, let's say on a monthly basis, most of that time you weren't anticoagulated properly. You might be overcoagulated, which runs the risk of hemorrhage, or you can be insufficiently coagulated. So important to have you see someone who knows about the mechanisms of how these drugs and nutrients work, how their proper monitoring works. Long story short, is there a chance that someone who does not want to go on the prevailing medications like the clopidogrel and the warfarin and the aspirin, can they do it naturally? The answer is maybe. It depends on the problem. So you want to take that problem and you want to give nutritional supplementation that is in the orthomolecular dose. That just means in an optimal dose. So different people need different amounts of omega-3s and garlic, for example, or vitamin E, which I didn't put on the list. That's another anticoagulation. And then if they have other medications, they need to be considered in the context of whatever nutrition you're using to try to thin the blood. And then, of course, even the diet matters, whether you're dealing with medication anticoagulation or like, for example, most of the medications for anticoagulation, particularly warfarin, they are adversely affected if you eat too many grapefruits. So grapefruits have a compound that affects the detoxification of that drug. So it's not an area of medicine and health that you want to take lightly. So I want to thank you for joining me today for this presentation on coagulation. Please let me know what you thought about it, and I'll see you at the next podcast. Take care.